So my name is Kiran Martin. I'm a pediatrician. I am the founder and the director of an organization that is called ASHA. I began ASHA in the year 1988, and so it's been over 23 years since I started, and the organization is now working in over 50 slums that are spread all over the city of Delhi and covering a population of about 400,000 people.
How did you first get the idea for ASHA?
I went to medical school here in the city of Delhi. It's a medical school that comes under the University of Delhi. And while I was studying there, the school was affiliated to public hospitals, and the kind of patients that would come from slums or from villages close by, or sometimes even far away for treatment. And it was quite clear that they were extremely impoverished, and that the only system that they could resort to was the public hospital system. They didn't have the means to be able to seek out health care from private parties, or there were no NGOs in the city of Delhi around that they could go to for health care. And I felt very drawn to this population because I was also quite aware that medical doctors graduating out of Delhi University most popularly would either make their way to Western countries to seek better opportunities. The most popular countries were the United Kingdom and the USA. You know that there are a lot of Indian doctors in the United States. And of course, a lot of them went in for private practice in the city of Delhi. It was, I mean, a lot of them had fathers or mothers who had an existing practice that they wanted to inherit, and there were others who wanted to start themselves. There were so many opportunities for it. And so essentially, out of the 14 million people living in the city, 4 million of them were living in the slums. And the entire population of doctors was concentrated among the 10 million who were middle class, came from middle class and rich communities. And of course, for the 4 million slum dwellers, there was hardly any provision for healthcare. And I was really motivated, and there was a compassion that was there, but then I wanted that compassion to be well directed. I wanted it to be combined with professionalism. And so it was important to look for ways that I would be able to professionally reach out to this population of slum dwellers in the city. Now, of course, you know, as a young student, you're idealistic, you think about these things, but when you actually begin to do these things, it's not easy. I remember that it was the month of August, and it was the year 1988. And my husband and I shared what I wanted to, what I was feeling with him, and I said, you know, and I actually had a government job already lined up, you know, and so, you know, I kept getting letter after letter them asking me whether I am willing to join or not, you know. So obviously government jobs in India are highly sought after because they come with all the security that a government job comes. You know, and then I thought to myself, and I discussed it with my husband, and I said, if I don't take this step now, I'm never going to take it. I know that, you know, and I need to take that risk, and I need to abandon, you know, this whole feeling that I must have a secure job from the very start, or else I'll never be able to do what I really think I want to do. And so we had this little scooter in those days. I don't know if you ever see them on the streets. They're not very commonly seen now, but at the time, and we went around the city trying to look for different slum areas. You know, I come from a middle class family, but there's a big divide between the haves and the have-nots in the city, and typically people from middle class families, or of course wealthy families, would never think of going into a slum. So, you know, you see them at a distance because they're everywhere. So if you drive around, you know, if you're in your car or if you're traveling in a bus, you know, you will often see them, sometimes at pretty close quarters. But you usually never think of going in there. And of course, there is the stigma attached to a slum of it being a place where there's petty crime and there are all kinds of problems. And therefore, children are always raised to think that these are not places that are good for them to go to. And I was also brought up in a similar way. So growing up as a child, I never entered one. So in fact, when I finally decided that I wanted to go and see what it was like, it was going to be the very first time because I had never done it before. And believe me, I was really shocked. I was so shocked that I was shocked out of my mind when I walked into this slum. It was called Dr. Ambedkar Basti, and it was named after Dr. Ambedkar, who was a Dalit leader, and of course he wrote our Indian constitution, but he represented the untouchables and the lowest classes of people, the lowest caste in Hindu society, where you know that it's divided, there's a caste system in place. And I actually couldn't even go through the main entrance because there was a huge mountain of garbage greeting me. And also there was no road, there was nothing but slush and dirt, and I couldn't understand how I would be able to go inside. You know, it was not very far from where I was staying, and I didn't want to be too far away from my daughter, who was only at that time, she was a year and a half old, and so I wanted a place close by. So I came to this one. Finally, I found a little fence at the back, and that fence was just by the side of a huge open drain. It was massive. It was so filthy, it's unimaginably filthy. So I found my way into the slum by jumping the fence at the back, and then I came inside. And it was so horrific what I saw, you know. I mean, like, there were little shanty huts everywhere. There was, you know, pigs and rats and mosquitoes and flies and stray dogs and little kids, all, you know, little kids rummaging in garbage, and there was you know, women looking so sick and anemic and exhausted, and so many men lying around doing nothing, not working. The environmental situation was quite horrific. There were no toilets there, so people were just going by the side of that drain that I just told you about, you know, or even just perching anywhere, essentially, squatting anywhere, because that's all they had. They didn't know what to do. They couldn't even get a bucket of water. It was so hard because they didn't have any sources of clean water. What they had done is they had dug up these shallow hand pumps that were only 30 feet deep, and so the water that was coming out was contaminated and it was brown in color. And so anyhow, so I came in, and then finally when I started talking to the residents, everyone was very keen when I said to them that I'm a pediatrician and I'm wondering whether I can help you. I really would like to help your community. I found that there wasn't any space, you know, every inch of space was occupied by a slum hut, you know, so slums are very congested places. There's a density of population is very high because there's no place. I mean, and so you'll find, you know, huts maybe of the size of 50 square feet, 80 square feet, 100 square feet. If there's a bit more luxury, you might find a house with 150 square feet, but that's rare. And there was no room, and so anyway, everyone directed me to whom they called the Pradhan. Now, I, of course, then tried to find out where the Pradhan is, and I found out that basically there's no democracy in a slum. It's not like you have an elected leader or an elected group of people. Like in Indian villages, you have the panchayat system where village leaders and village elders are elected. But in a slum area, that system does not exist. So the slum lords are typically self-appointed, and they're very often politicians at that level, at the slum level. And they owe their allegiance to a particular political party. In this case, this particular slum lord was a Congress party worker. And he was there because he was a politician, and he wanted to make sure that the entire slum voted for his party when the elections came. But essentially, it was a dictatorship, and also he felt that everyone must listen to him and to his group of people. And he also felt that he was all important, and he exploited the poor because they didn't know really how to work the system, and they were dependent on him. So it was like he was a necessary evil, you know. And so when I approached him, I was so young, you know, at that time I was just a young doctor in my 20s, and very idealistic, and thinking that, you know, there are all these poor people in the city, and, you know, I have these skills and I'm willing to dedicate myself. I don't care how difficult it's going to be in a slum. I'm not even worried about financial security because my husband will earn while I can do this and establish something worthwhile. But, you know, initially I was met with so much hostility because the slum lord looked me up and down. He said, "What do you want here? What is your reason for being here?" He was so extremely suspicious of my intentions, and he wanted me to explain myself thoroughly. So I was quite taken aback by this initial reception. And of course, by and by, realized how slumlords feel that their popularity is threatened when somebody comes along to a slum that is trying to help to improve the situation in the slum. And plus, they also automatically get exposed for their misdeeds, even though a person who's doing something good may not necessarily intentionally do anything like that with that person. So So anyhow, so he didn't even entertain me at the time. He said to me that he'll think about it and let me know. So I went back feeling so despondent and so discouraged, and I really thought maybe I made the wrong choice, and anyway it's so difficult, how am I going to even survive in this dirt? The stench was so powerful in the air, I could hardly stand there. I felt like vomiting, because it was so horrible. But a few days later, suddenly there was a cholera epidemic that broke out in the city, and that epidemic took the whole city by storm, and most of the people who were dying were the children who were in the slums. And the same epidemic hit Dr. Ambedkar Basti. So the same slum lord called me up and asked if I would be willing to see him again and look at the possibility of working in that slum, because he needed a doctor so badly at the time. So I went in thinking this is a good opportunity, and he gave me a little space outside his own hut because there was nothing else there. And so I just sat there, and I would see patients in that open courtyard. It was very hot at the time and muggy and sultry, but there was nothing there, not even a fan. And I would take all the pregnant women and other women, when they had to be examined, I just make them lie on a rope cot that he gave me in his own house. I was also giving IV fluids to children in their homes because they were refusing to go to the hospital, and there were so many of them dying of dehydration. So there was a lot of things that I had to do that were completely unconventional, but then they saved lives because that was the need of the hour. And by, everyone started thinking that I must have a proper clinic, otherwise how am I going to, survive in this courtyard and for how long, when I say courtyard, it was nothing but a tiny little space outside his home, not more than 50, 60, 70 square feet.
I think Suni mentioned it was under a tree.
Yes, it was. There was a tree there.
And that was it. At the base of a tree, you started a clinic.
Exactly. And in fact, I just had a suitcase full of medicines that I had from well-wishers and friends, to help me along and to give them to patients because they were too poor to go and buy them from the chemist. And the levels of poverty were extremely high when I started. Even 2 square meals a day was something that was so challenging for a slum family to obtain, because illiteracy levels were high. Female literacy rate was hardly 2 to 3%. It's hardly 10% of the children were going to school. 90% of children were just engaged in some form of child labor or just playing around on the streets doing nothing. So from that courtyard, then there was one little space which was reserved for community meetings, but the slum lord ultimately gave it to me and said that you build your own. And there's one organization that I can never forget in my whole life that came alongside me, and that organization was called Tear Fund. It was based in the United Kingdom, and I wondered whether they might be willing to come and see what I was doing in the slum. So when they were visiting Delhi, they agreed and they came. And they saw the kind of support that by then had built up. There was a relationship there because I was not, I tried to demystify medicine. I was sitting there among the people without any large barriers of beautiful buildings and all of that. I was right there, right in the middle of all the slum huts. So there was a natural empathy, there was a relationship that got built. I was also very interested in their other problems, and they would talk to me about them after the clinic was over, and I tried to understand the other difficulties that the slum dwellers were facing. So there was a relationship there. So when Tear Fund came in, they saw that, they saw this little clinic which was being run out of just one room, and then they offered to extend their support, their financial support. And that was how I actually began the work of ASHA. Because when Tear Fund came along, they said, well, we can fund your project. And then of course, by and by, I started looking at ways of registering a full-fledged organization. The very first person who joined me was a nurse. And nurses can get very lucrative jobs in this country because there's a huge shortage of nurses in our country. And so to find a nurse who was willing to sit in that courtyard with me and help me, it was a real boon. And I had such a marvelous relationship. It was the start of a partnership that lasted for over 15 years. And they were instrumental in helping me expand to so many different slums, because the first few years there were marvelous opportunities, because at the end of the I started in August, and so in December of that year, we heard that the slum commissioner, who is the head of the slum department that looks after all of the work of Delhi slums, he was coming here to this particular slum to inaugurate a toilet complex.
How exciting!
And the toilet complex was located at the edge of the slum. So we saw our chance. Well, the government officials are coming to us, so we must present a charter of requests and demands to them in a peaceful manner, and also encourage them to come inside, because the complex was at the edge, and we knew that normally they would just inaugurate it and go away from the outside without actually coming right in. So I mobilized the community, and we all were waiting for them. In fact, the engineers were trying to, what they call it, dress up the slum, meaning, put some mud on the dirty ponds or on the slushy areas and make it look a little clean and all that. So we resisted that. And we said, we really don't think we can allow this, because we want the slum commissioner to see the way people are living over here. So he came, and of course he was quite surprised that he was being greeted by me and like around 400 people from the slum. I don't think he was expecting a reception of that nature. But then we very respectfully talked to him after the inauguration was over. We said, we really would like you to come in. And I always had one of the values of Asha is right from the beginning, that it's not about confrontation, and it's not about aggression, and it's not about force, but it's through creation of goodwill and through empathy towards all. And you have to understand that the slum commissioner also is a product of his own environment, of his own bureaucracy, of his own systems, and it's very easy to shout and scream and get the slum commissioner frustrated. He never come back. We need to build bridges, we don't need to build barriers, and so therefore we started talking to him very respectfully, and we said, we'd like you to come inside and we'd like you to see. And he was very hesitant, because never thought he would have to do this, but he realized there were so many people, it would look really bad if he said no. So he came and he couldn't even walk. His feet were going right into the slush, And he came right in and he saw the condition, he saw the little clinic, and he was really motivated by that visit, because then he immediately called me back, and that was the start of a relationship with the government of Delhi. So I had two primary partners. One was the government of Delhi, and the other was Tier Fund. And then of course I had the community, because I was very clear right from the start that I do not want to give handouts. I do not want to create a system where I'm only giving them a palliative. I want to make sure that the health of the whole slum is improved, and for that community members need to take the lead. Community members need to be at the forefront of change. Community members need to work in active and true and real partnership with Asha.